All right, welcome back to the big show. So November is Lung Cancer Awareness Month. You know, lung cancer is one of the most common types of cancer in the United States among both men and women.
So for those who are higher risk, getting an early screening before symptoms start can really make all the difference. Joining us to thrive with Twin Cities Live and talk about lung cancer screenings is Dr. Melissa Korb. Melissa, thank you for being here.
Thank you.
We're so happy that you're here. I think this impacts a lot of people. I also think of lung cancer as being sometimes misunderstood, because you'll hear of people who like, I never smoked a day in my life, and then I got lung cancer, and you wonder how that can happen. But let's dig into screenings. Number one, are they a good prevention method? And number two, what are we doing to screen?
Of course. They are a good prevention method. That's why we've now started recommending them. Of course, the best prevention is to never start smoking, but assuming that's not an option, then getting a low-dose CT scan is the best way to prevent cancer. Lung cancer is the #1 leading cause of cancer death in the United States. Approximately 227,000 people will be diagnosed with lung cancer this year.
Wow.
Oh my gosh.
And so when you say prevent, I mean, we're really talking about preventing death, right? Because you're screening, so the idea is you're hopefully catching it early enough to do those types of interventions so that you survive the diagnosis.
Exactly. So catching it early is key. When it's causing symptoms, it's going to be later stages. So that's why before you have symptoms, if you meet the criteria for screening, you should go get your screening CTs to catch this early. If you catch lung cancer in stage 1, it's 90% 5-year survival, whereas stage 4 is less than 10%.
Ooh, that's scary. Okay, so let's talk about the actual screening process. Like, how long does it take? Is it just a quick in and out at like an outpatient thing? Like, what's that like?
So it's a low-dose CT scan, which basically is just a regular CT scan. You go in, you lay down, you don't have to get an IV, there's no contrast or anything used. It takes about 5 minutes. You take a deep breath, hold your breath, they run you through the scanner, and
That's it.
That's it.
Okay, so how do you know if you should get screened?
So the screening criteria, there's criteria that have been laid out, and the criteria are if you're between the ages of 50 and 80 years old.
Okay.
If you have smoked 20-pack years, so that would be 1 pack a day for 20 years, 2 packs a day for 10 years, math like that.
Think about how much you could have in your savings account if you would have saved that money.
I agree. That's a very expensive habit.
And then either still smoking or have quit within the last 15 years.
Is there a family connection too? If you have any family history, do you get bumped up on the criteria?
There are some, but the biggest risk factor that we have right now is the smoking history.
Yeah.
I mean, there's other risk factors. Secondhand smoke, the radon exposure. Radon is high in Minnesota, and those are also factors that can be attributed to lung cancer development.
Okay.
But right now, the only criteria are for smoking.
So we're looking at the #1 cancer in the United States, and it's really all environmental and lifestyle. I mean,
it's not the #1 cancer, it's the #1 cause of cancer death.
Another one of, okay. But it's all like environmental stuff. So if you're around stuff like that, or around smokers, and then you're doing that to yourself, I mean, that is super fascinating. So if you come in, you get the scan, you find a little something that doesn't look right. What happens next? What's the next step in the process?
So the next step in the process is generally you'd be referred to someone like me, and I would take a look at the scan. There's different criteria that we use to sort of gauge these nodules, how big they are, what they look like on the scan, and that would prompt us to either say, we're going to follow this with another CT scan in a few months, or this looks concerning, given your smoking history, we should really send you for a biopsy.
Is this oftentimes scary enough for people to go, okay, I've got to quit? And if you do quit, is there a good chance that your body can kind of cleanse? I mean, our bodies are so amazing, and they always want to heal. Do you see a reduction in risk the longer you've quit smoking?
So absolutely, the scare factor is real. A lot of people do get kind of, so to speak, scared straight, and will stop smoking once these things come up, certainly if the diagnosis is cancer. Unfortunately, the damage has been done. Once you stop smoking, you do sort of, your lungs never regrow or regenerate. You do sort of regain some of the pulmonary function that you lost from the years of smoking, but the cancer risk is still there.
Is still there.
Yeah, all right, that's too bad to hear, but I know I want to have as much time as possible you have a very important thing that you want to talk about, vaping, because we see a lot of people doing it. I mean, I feel like the narrative out there is like it's safer, it's better, it's cleaner than normal cigarettes. I know, and it's a big problem in schools. So Please tell us about your thoughts on vaping.
So personally, I hate vaping.
Yeah.
It's not been in the United States long enough to show a correlation with cancer at this point, but I am confident that at some point down the road, we're going to see a very strong correlation between vaping and smoking. One vape cartridge is equivalent to the amount of nicotine in a pack of cigarettes.
Whoa!
In a full pack.
In a full pack. So if you're smoking one vape cartridge a day, you've smoked a pack of cigarettes, or the nicotine equivalent. Now, it doesn't have all the same chemicals in it as a cigarette, but those vape cartridges do still have chemicals like formaldehyde, which is embalming fluid, the same chemical as antifreeze, cleaning chemicals. I mean, the stuff in there is not normal. It's still bad to breathe in, and that smoke is so much hotter than cigarette smoke that it actually fries the inside of your lungs and causes a massive inflammatory reaction in your chest.
And you're seeing a big difference when you're looking at patients?
So when I operate on somebody who has vaped versus somebody who's never vaped, there is a lot more inflammatory tissue inside the chest, scar tissue around, that makes it more difficult for me to do surgery because of the vaping.
Unbelievable.
Yeah, so that's why you're saying it's safe to say, even though the research isn't there yet because vapes are fairly new, so probably not a long-term study, you're saying with your own eyeballs, in your own practice, you know it's worse.
Yes.
Well, listen, this is really helpful information, and I think if anybody, if you can get scared straight before you are reaching the office of the doctor, it can be really helpful. Thank you so much, Dr. Korb.
Thank you.
Really
so
good
much.
info.
All right, everybody, take care of yourself, please. All right, to learn more about lung cancer treatment and providers, Minnesota Oncology is Twin Cities' largest and only independent care provider. They offer expert, compassionate care close to home.
So Minnesota Oncology has more than 100 cancer care specialists and multiple locations across the metro. The colon and rectal surgery associates recently joined the practice, so that's expanding those comprehensive care options as well. And you can learn more at mnoncology.com. I'm going to agree. I hate the vaping. Hate is a strong word, but I'm going with it too.
Yeah, and I don't think it doesn't look cool. Everybody, it's not cool.
No.
All right, Vintage Vibes meets Thanksgiving coming up in Twin Cities Live at 4. Find out how an interior designer creates stunning table settings with vintage flair.
Yay.